So the breast augmentation is a surgery that increases the volume of the breast, while the breast uplift change the shape and change the position of the gland and the nipple, making the breast shape slightly higher and fuller on the upper part. Sometimes we combine the two surgery. It depends where the gland sits in the original breast shape. So when we do breast augmentation alone, the pro is that we got a smaller wound to deal with, but sometimes we cannot do a breast surgery alone because the gland is too saggy or low. And that's why uplift will involve more scar, but could give us a better reshaping of the breast. If we combine both procedures, on the good side is we got more flexibility on the surgery, on the reshaping of the breast, but we got more complication risk, and that's why we ask patients to rest slightly longer. If you don't like the volume of your breast, we could increase the volume with the fat transfer or with implants. So increase the volume with the implant is more predictable and easy to achieve. If your gland is below the inframammary fold, if your nipple is really low in your chest, an uplift will be mandatory, and a consultation will clarify your doubt. A breast uplift alone is a good surgery, is a good choice if you want to have a super natural look, a low upper part of the breast. And sometimes we suggest it in advanced age, but younger is the patient, so more high look, more high cleavage, the patients desire to have it. And that means having an implant could give you a better result, because gravity affects the breast, and the breast volume, the breast gland will drop below the inframammary fold. The recovery, whichever surgery we do it, it lasts around 6 weeks. And that doesn't mean to stay at home in bed for 6 weeks. And none of the breast surgery deserve that from a patient, but we ask to avoid exercise, to avoid to sweat, and to avoid to lift a heavy object for 6 weeks, even if you do a simple breast augmentation, because the wound need to seal, they need to heal, and we don't want to incur a problem. And that's why we ask patients to avoid the strenuous exercise for 6 weeks. A breast augmentation is a long-lasting result. Breast implants at the moment are really good quality, and so they could last for years. They are insured for 10 years, and so we could predict the age of implants in 10 years' time, but probably the implant could last slightly longer. We will have a different technology, and with the checks, probably in 10 years' time, we could understand a bit more than we do now. A breast uplift alone will last as long as the patient's age. Sometimes a change of weight or change of habit and a change of a healthy lifestyle could let the breast age in a month. So it depends. It's more related to patient's body. While when we use the implant, we could predict a bit more. Technology and references, study, they give us a better idea. And that's why using implants sometimes give patients a long-lasting result.